Welcome to the Dental Implant Practices podcast, where each episode will explore how to integrate dental implants into your practice and into bone, with your host, Dr. Philip Gordon.
Welcome back to another episode of the Dental Implant Practices podcast. This episode is a recording from the Dental Implant MBA conference this last September in Newport Beach, California. The speaker is the president and CEO of Progressive Dental, Bart Knellinger. They are a full-service marketing and coaching agency. Thanks for listening and sharing. Hope to see you on the Facebook page, and go to our website, www.dentalimplantpractices, to keep up with all our events. Hope you enjoy. Okay, we've got Bart Knellinger with Big Case Marketing Production. He's from Progressive Dental. They are taking over my web development, and so I thought I'd bring them out here and show them what we're doing with our practice and have him show you what he's doing with mine. So, Bart, I'll leave it to you here.
How's it going, guys? It's nice to be in California again. We're some of those scary East Coasters out in Florida. But I'll tell you, you talk just fast enough to keep up with us out there. You shouldn't be scared. You'll get along no problem. Like he said, we kind of specialize in advertising, marketing, coaching, consulting, specifically for some of the larger cases. We've been around about 10 years, and we're a full-service agency. It just means that we do everything in-house. So everything that we create in-house. We have our own continuing education courses for our clients to attend with their treatment coordinators and their patient advocates and their teams, so that we can make sure that they're converting and selling and closing the leads that we get for them. And it's been a really, really cool journey. I'll give you a little bit of an idea kind of into my background, a little bit of the story of the company. Because it is pretty unique. This is probably as close as I'm going to come to an MBA. I own the company. Again, Bart Knellinger, President, CEO of Progressive Dental. And my father was a dentist. My mom was office manager forever. I've got 3 sisters, 2 of which are dentists. One is an attorney. So no history of going to college in my family at all, right? So my success story is the exact opposite of the usual success story. It was like first generation to ever go to college. I was kind of like the first generation to not even go to orientation for college, right? I went right out of high school. I moved from Florida to Chicago, and I ended up selling door to door for about 4.5 years up there as my education, if you will. And boy, was it an education. What did I sell? Anything that was basic. If it was 30% legal, or I could make a case for it to be 30% legal, then I sold it. Okay? Anything that I could get my hands on, that's what I did. But it taught me a lot about business. And over the course of the year, I got more and more into advertising, until my dad finally called me and he said, "Hey, I'm spending like triple. I'm spending triple the money trying to get the practice ready for your sister to come in, and I'm spending triple the money on advertising, and the practice stays flat. I feel like whether I spend $15,000 a month or I spend $0 a month, the practice is where it is, and the needle just doesn't move. And all I do is do what everyone tells me to do, and I don't get any results. So would you mind coming in and kind of taking a look at it?" So I said, "Sure, of course." So the first thing I did when I looked at it, kind of to Dental Intel's point, I kind of just asked some pretty basic questions like, okay, what are you spending your money on? What's the volume? And then what is the direct response rate, right? Basically, how much are you paying per lead? Is it working or not? First thing, and I didn't know any of these things were generalized at the time, but first thing that I saw was there was no analytics, right? So we didn't know. So I talked to the girls at the front. I said, "Hey, and I believe he was doing mailers, he was doing some TV advertising, he was doing a lot of advertising to try to grow the practice to get ready for a new associate." And I would ask them and say, "Do you guys notice when the advertising hits, we get more calls?" And they're like, "Yeah, we get more calls, but they're not really the type of patients that we want. They're price shopping, and this practice is fee for service. We don't accept insurance, so we have kind of a battle with the insurance type questions and things like that." So I said, "Okay, so you don't want people that are looking for price?" And they said, "Not really, because we're kind of on the upper end in terms of fees." So I said, "Okay, so let me take a look at the advertising." So I started looking at the creative, and what's there? Right on the mailer, first thing that you see, what is it? It's like a price special. So I was super surprised that they were surprised they were getting price-focused patients when they were advertised. Price was literally the focal point. And I said, "Look, it's not bad. There's a lot of businesses that do this, but this is basically a funnel. You're funneling them in to upsell them on other things later. But it's actually working exactly how it's designed to work. Well, he says, well, that's not what we want. So I said, okay, well, what do you want? So we need 85 new patients. We need 85 new patients per month. And I thought, okay, well, how much do you want in terms of revenue? He's like, I don't know. If we have 85 new patients, we're going to be fine. So I'm like, man, 85 new patients. He's like, that's what we need for 2 associates. Okay. So that was a little different than traditionally in business. You don't say how many you want in terms of volume unless you're in a commodity business where the costs are very, very consistent and the pricing is very, very consistent. You can do an easy formula for how to scale, and then you can scale with volume. But in service-based businesses, most of the time we're talking about how much you want to grow in terms of production, how much you want to grow in terms of revenue. But I kind of noticed that there was a cascade of events that would start to happen because of this volume. So number one is that the schedule would fill up really fast. And then when I would look at the schedule, I'd say, wow, you guys were slam busy today and we only did like $4,000. How is that possible? They said, well, just fill the schedule. So they were filling the schedule with activity and they weren't necessarily filling it with production. So don't mistake activity for accomplishment or production for profitability, because they're 2 totally different things. So that's when I first said, hey, why do we have to advertise for volume? Why can't we go after specific cases that are a little bit higher in terms of dollar amount and that are advertised less? Because the most competitive thing to advertise, what do you guys think the most competitive thing to advertise in dentistry is? Yeah, it's like a cleaning or a free consultation, right? Those 2, that's where 90% of the dollars go in dentistry. So when you're competing in that arena, it's like, hey, I mean, how much more can we give away with an initial discount before it's ludicrous? I did see an advertisement a couple months ago for free dental implants, though. I did see that ad. Free dental implants, and they're just upcharging on the crown and the abutment. So it can only go so low before we're actually going to have to start competing and start doing some real advertising again. So we've got to have some type of strategy. We've got to have a little bit more marketing intellect involved than just a price discount. And the craziest thing is when you do price discount, there's not even the sales process on the back end to maximize it. So you get a bunch of one and done patients that come in, go back home and never see it again. And that's the worst part about that strategy, is we don't have the sales process attached to it. So when you start looking at the dental implant market, and remember, when I first got into this, when you're talking about big cases that we advertised for, we did big cosmetic cases, we did big complex occlusal cases, we attracted big full mouth reconstructions, things like that, and we slowly but surely started to integrate into the dental implant market. 8 years ago, we had a handful of clients and we had a couple of people at the company. Today, we've got over 1,000 clients in every major market in the country. We've got 70 full-time employees, and we're well into 8 figures in terms of a revenue-based company. So there's really nobody else or no other company that's seen more dental implant marketing campaigns than we have. No one's seen more, executed more, or come up with more strategies than we have. And we've come up with some things that have worked really well. We've come up with some things that have totally bombed. We've come up with a lot that just require a little bit of adjustment. But I want you guys to get a lot of value out of the next 15, 20 minutes here. So what I'm going to do is just kind of cut through all the pleasantries here and just give you some of the core things that we've learned over the last 8 years, that if I was just starting out, and I don't know where you guys are in your implant practice, right? But we work with doctors that are just starting, that are trying to kind of get off the ground, and they're not doing some of the bigger, more complicated cases. And we work with doctors that are already doing 500-600 implants a year, and they want to specialize and focus more on the full arch immediate cases. We've got a lot of clients that do over 1,000 implants. But I've seen over and over and over again doctors that start off doing 50 or 60 implants a year and come up with a good strategy. Year 2, year 3, year 4, all of a sudden, this is one of those doctors, and you never know it. I've got clients, you guys would never know how big of a beast they are, but they're doing 12, 13, 1,400 implants, and no one knows who they are, but they're kicking everyone's butts in their market. So I'm going to show you guys a couple things, a couple really good takeaways for today. So as you know, and they already went over this, but baby boomer population, there is tons and tons of opportunity in the implant market. Anything with implants, anything with perio, anything with occlusal issues, all of those markets are wide open. The first one we actually exploited to really get the company off the ground and do well, first thing I ever advertised as far as big cases were big perio cases. It's the first thing we ever did. We started with the hardest one to sell and convert, right? But the reason why I did it is because no one else was advertising it. There was no one else in that area advertising perio, and I figured, hey, if they have moderate severe perio, if they've got mobility, they're going to come in. They're probably going to have bone loss. They're probably going to need implants. They're probably going to be reconstruction cases. They're going to need a lot of work. So I just wanted to bring in more comprehensive cases so that our days could become more productive and our days could become more profitable, and you can scale it without killing yourself. Because if your goal to scale is just more and more and more patients, there's only so many hours in the day before you have to start getting bigger cases. And that's where most of my clientele lies, is saying, hey, Bart, we're doing really well. We've been very successful, but I would like to really do more of these type of cases. I'd like to do more implants, or I'd like to do more full arch, or I'd like to do more ortho or cosmetic. And I want to hire someone to come in and take on the bread and butter type dentistry, the fillings and crown and bridge work and things like that. And when you get to that level and it's working, that's when you start to have some real freedom in your business, meaning when you're off on vacation, it's still turning a profit. When you're there, you're highly profitable at a $15,000, $20,000 production per day goal. So there's tons of opportunity. Everyone is kind of getting into this, and frankly, it's pretty easy right now. It really is pretty easy. If you can't make money right now, you're going to have a real problem in the next 6-7 years, because it's not that hard to make money. People are spending money right now. You've got financing companies that are willing to loan money to people with a 620 or a 600 or a 580 credit score that 3 years ago was not a possibility. So we can get them financed. The economy is doing great, and it's a really, really good time. But what happens when that happens, right? You get an increase in competition. You get an increase in the amount of people that are advertising. And we've already read this book. We saw this before the last recession with cosmetic dentistry, right? How many people were advertising cosmetic dentistry like crazy? All these elective procedures. And then they're like, well, cosmetic dentistry is not doing it anymore. Let me advertise something different. Then you started to see them segment the marketplace and commoditize it. So they say, well, I'm not going to advertise cosmetic dentistry and what it takes to get a great aesthetic result. I'm going to advertise veneers. I'm going to advertise lumineers. I'm going to run a price special for whitening. And then it stopped being about the dentist and it started being about the veneer. So the public started to get this perception that a veneer is a veneer no matter who places it. A lumineer is a lumineer no matter who places it. Whitening is whitening, it doesn't matter. Why is that troublesome from a sales perspective? A, it's not true, but that doesn't matter in marketing. Perception's reality when it comes to marketing and sales. Okay. The reason why it can be difficult is because if you're advertising, you're in a competitive market. Everyone's advertising price, price, price. We have to understand how to play in that arena and how can we still appeal to the consumer side of their brain. Because sometimes they're not looking for the cheapest implant. And implants by far is the most commoditized sector of dentistry right now, outside of consultations and cleanings. It just is. That's how much competition there is in it right now. But it doesn't mean that someone's going to go and pay, call an ad just because it says $29.99 for dental implants. They're looking for a deal. That's it. That's what we have to understand. They're looking for a deal. So I'm going to show you guys a concept here about bundling and about adding value instead of discounting your price. That's going to be a huge, huge, huge game changer. My clients, in general, are charging more than the competitors. My clients, in general, are charging more than all the DSOs. We're charging more, but we add more value. If you show them that they're getting $5,000, $6,000, $7,000 in value, but they're only paying $4,000 for the implant, $4,500, because we've added in a warranty, we've included the maintenance, we include the extraction, whatever it is that we're doing to add value, you can sell these procedures for 20, 25% more than your competitors, and you can do more volume. We have to understand the consumer psychology as it pertains to implants and kind of how the public sees them. Does that make sense? No? Good. Perfect. Good and the bad news of the increase in advertisers, right? The bad news is that the more people advertise, what happens to the cost of advertising in general? Well, it goes up. Cost of media goes up. The more competitive it is, the higher the rates go. That's the way it is, supply and demand. When they're advertising, they only have one strategy for the most part. What kind of dental implant marketing outside of a Clear Choice, maybe in Eon clinics, do you see that's not very, very, very price-centered? Okay, and especially for the doctors that aren't doing some of the bigger, more complicated cases, if they're just like, I just need any dental implant case, it's almost always price focused. Anyone have an issue with this in your market? Anyone have competitors charging lower fees than you? Well, what's the strategy? What's the strategy to where when someone looks at it, they don't just see the implant. They don't see the implant as a commodity. And I'm going to show you. In California, it's like one of the worst. I mean, some of the markets are super saturated, and all of them are at this point. But Southern California, Vegas, Phoenix, Chicago, I mean, all of those areas have a great deal of competitors in this space, and 99% of them live in the price lane. So we have to have a really good idea of what we're going to do. And instead of showing you guys websites and showing you guys advertisements and different campaigns that we run, you have to understand the psychology behind this, because that's what this is about. It's about scaling and growing a business and making money. And we can look through a keyhole all day long at all of these different things. And here's a good website, and here's a good direct mail, here's good TV, when to use it, when not. But if you don't understand the consumer psychology and you don't know how to sell it, then you're never going to market it. Because marketing and sales are no different. When I'm selling and through dialogue like this, talking to you, I'm selling the same exact way. I'm just using a media to do it. So you're either selling through copywriting, or you're selling through audio, or you're selling through visuals. You can do a lot of selling right with a before and after photo. But you have to know what they're looking for, and we've got to be able to shift their focus from the procedure to the clinical outcome. It's critical. You can't get them focused on the clinical outcome and get them to see a better version of themselves. Then you're going to struggle with this constantly. It's going to be very tough to hit scale. Very, very tough. So the first thing I understand with this price-based advertising, it only hits one small sector. Now, do we run pricing specials? We kind of run the opposite of pricing specials, where we're qualifying people out, right? And again, this depends on where you are in your practice. And that's really what we need to know from a corporate standard view and a strategic point of view. We have to understand where you are in your practice now, where you want to be. We got to be really clear on a timeline and how you're going to get there. Now, we help you guys out with creating a strategy of how to get there. But if you're just now starting off and we're looking for more singles, we want to stay away from the full arch, that's going to be a totally separate strategy than if you're already placing a couple hundred implants and you want to focus on multi-implant cases and immediate load hybrid cases or zirconia cases. Price is only going to focus and really hit one aspect of the market, right? So write this down, guys. You got three different ways to advertise implants, 3 different sectors where the market is. And this is consumer psychology, right? You can have a really good candidate looking for something totally different. You got a certain percentage of the population that is symptomatic. So they're currently experiencing symptoms. By symptoms, I mean pain points, right? So they've got a tooth that's loose. They're missing a tooth. They've got severe periodontal disease. They grind and clench their teeth. They're breaking restorations. All of these different symptoms. Now, when you have a symptom and you're not sure what the solution is to fix it, what are you researching as a consumer? You're researching the symptom, right? Look at any of your competitors' websites. Look at their web presence. How much information, how much data, how much education do they give on the symptoms associated with implants? Not much, right? So the symptomatic market is not a market that most people advertise to. And the symptomatic market is bigger than the shopping market, okay? So you got patients that are symptomatic, meaning they have a pain point, but they do not know yet what needs to be done. You got people that are doing research. People that are doing research knows, okay, I have to have something done. I'm trying to figure out which one. So a lot of the research-based mindset is kind of looking at, okay, implant supported denture versus all-on-4, right? Or they're looking up dental implants versus teeth in a day. It's usually a compare and contrast. They might be looking up a bridge versus a dental implant. They could be looking up a lot of different things. But again, they're not shopping price yet. Why? Because they're not sure what they need or what they want. So they're earlier along in the buying cycle. Does that make sense? Do you see how someone that's symptomatic is going to have a totally different message than someone doing research? Right? The same message is not going to resonate with those two audiences right off the bat. Now, if they're shopping, what's their mindset? I know I've got a problem. I know what I need. I know what I want. I'm going to shop to make sure I get a good deal. It's not like the the car industry where there's MSRP. How someone that's never had dental implants before, and now they need a multi-implant case, how do they know what fair market value is? I mean, you tell them $16,000, $17,000, but when they're sitting there in the consultation room, if you don't make it overly obvious that they're getting a good deal and they're getting a bargain for their money by showing them that, yes, it's $16,000, but you're getting $26,000 in work. If we don't have that set up, they're going to shop the price just because they're not sure if this is this high, is this low, is this kind of right in the middle. They just don't know. There's no Kelly Blue Book, right? So they shop around and now they're asking for pricing. It doesn't make them cheap. It doesn't make them cheap. It just makes them a consumer. And believe me, when you guys are working with me, you're all consumers. So I can attest for that, right? You're doing the same exact thing when you're in consumer mode and you're going to spend $30,000, $40,000. Very few people on this earth are going to drop $30,000, $40,000 without knowing and understanding where they are in that spectrum of fees. Is this high? Is this average? Is this a little bit low? So when you're setting up your strategy, you want to look at all three of these different markets, say, what do we have that's going to appeal to patients that are shopping, doing research, and patients that are symptomatic? What messages? And then how do we deliver it? So a couple different critical elements here. You have to show great clinical outcomes when it comes to marketing implant dentistry. And remember what we're advertising. We're not advertising dental implants. Get that out of your heads and don't let it back, right? We're advertising your work. We're advertising clinical outcomes. You're advertising before and afters. You're advertising transformations. That's what this is. How do you put a fair market value on an amazing transformation, an amazing before and after photo? When you look at it, you go, oh my God, it doesn't even look like the same person. I say, yeah, what's the fair market value to that person? To go from this person to this person. Well, you can't put a price on it, right? So we have to advertise things that cannot be commoditized. They're impervious to commoditization. They're impervious to price shopping. So what do people hold up as in terms of high value? They hold the transformations. People want to feel younger. They want to be younger. They want to be better looking. They want to enjoy their lives. That's what we're selling with implants. Okay, that has to be your overarching strategy. How many of you guys are good about keeping before and after photos on these implant cases? Yeah, good at it? And same thing with any type of case that's in the aesthetic zone, really good at before and afters. And I don't mean before and afters with a phone. Understand, advertising is about assets. That's what it's about. People think it's about tactics, but it's not. It's about strategy and assets. If I have one unbelievable before and after from you, I'm going to be more effective at every single tactic that you put your money into than with you. If I have nothing and you have triple the budget, I'm going to struggle more with Dr. Chef than I am with you, right? Because you're putting your money behind something that's not compelling. You're putting your money behind a price special. You're putting your money behind stock images and copy that's written by someone that doesn't know what the hell they're doing. You know, so you've got to collect the assets. So when you're taking your picture on your iPhone, know that this before and after photo, you're going to be using it next week, next year, 2 years, 3 years down the road. So take your time on the before and afters. Take your time on the video testimonials. Take your time on working with your patients and allow them to tell their story. Let them do the selling for you. Make sense? Got to have good clinical outcomes. We have to be able to describe the patient experience. Why is the patient experience important? Well, how else are you going to differentiate yourself? Saying that you do dental implants doesn't differentiate you anymore, right? Saying that you do it all under one roof doesn't differentiate you anymore. There's other people who are going to have that same exact message. What's the difference? The difference is your philosophy. The difference is the experience the patient's going to have. The difference is your comprehensive nature. The difference is different for every single business, but that's our job as an advertising company to look at you and say, what's a core story here? What's compelling? How do we advertise what's compelling? How do we advertise what's going to be different? All of this is worked out long before you say, should I do Facebook or should I do Google AdWords? You shouldn't do anything. You should figure out a strategy and then invest good money and time in creating compelling assets. Assets that no matter if we put money behind it on Facebook or TV or newspaper, those assets are going to bring in quality leads, they're going to be different, and they're going to work. When it comes to marketing, guys, the only thing you're paying for is eyeballs. Understand that. People ask me all the time, Bart, what's the return on the investment going to be? I said, that's not what you buy with advertising. That's not what marketing does. Marketing, you pay for eyeballs. That's it. That's all there is. Whether those eyeballs are going to convert into leads is going to be depending on the psychology behind the advertising. But that's not what you're paying for. That's not the marketing. Right? When you're paying for media or you're buying clicks, you're just buying traffic. That's all you're buying. You know, you showed a statistic, average click-through rate is 3%. Ours is 25% when it comes to dental implants. Because I've read this book thousands of times. I know exactly what keywords to pay for and which ones not to. But that's what you're getting. So you can have bad creative, bad copy, bad images, and say, the marketing didn't work. You know, AdWords doesn't work. And it's not AdWords. It was doomed from the beginning. It was just no good. You know, and the ROI, where do you get your ROI from? Is a combination of systems. Your ROI comes from the efficiency of your advertising, how many people you get in front of, what the conversion rate is, and then what is your conversion rate on the back end to sell these cases. That's where we really ran into some issues when we switched over and almost exclusively focused on big cases, was the fact that you get a lower number of leads, and you have to be far more sophisticated in terms of your ability to close. How many people can close, you know, a $1,600 crown, $2,000, $2,500 crown? A lot of people. How many can close a $25,000 or $30,000 full arch and close 10, 15, 20 of them every month? We've got single practitioners that do 30 arches a month. I've got single practitioners that do 9 a month, and they spend the same. They spend the same money, right? So if you're looking for, hey, I'm gonna advertise and judge the effectiveness of the advertising based off my ROI, you might be looking in the wrong spot right from the beginning and not even know it. So that's a combination of the two. But one thing that you should know, and this is how you should hold your marketing company or anybody doing advertising accountable, is what is your cost per lead? That's what you want to know. If I pick one data set for you guys to know and understand about advertising, it's your cost per lead. What is that? Because you spend the same, and your goal is lower the cost per lead. How do we do it? Get more eyeballs for less money, which is called cost per thousands, and change up the copy, change up the headliner, change up the CTA, use different assets, and see how we can get a better pull for what we're doing. So cost per lead is advertising. ROI is your ability to sell, close, and follow up. How good you are. That's what separates the practices that I see go from $1.5 million to 5 million, and they added no team members. They're just doing big cases and doing them in volume, doing them like crazy. And the practices that just kind of hang right here, you know, no matter what they do, it doesn't really make a big difference. Add value and create a compelling CTA. Write this down, bundle treatment, bundle treatment. Bundle your treatments. Anyone here advertising all on 4, full arch, teeth express, any of those larger type of cases? Well, those larger type, you do? What do you charge for full arch? 25? 20 to 25, just depending on the restoration. Okay, so let's say you charge me 25,000. Yeah. Depending on what the patient will pay.
You have to pay in full arch cases.
Mm-hmm.
We're talking about most people need it and lower income.
Mm-hmm.
Have to stay near the 20,000. When you start getting above that, then they perceive in their mind.
But that's your reality, but that's not the reality, right? And this is my advantage is 1,000 clients, every market in the country, right? I've got campaigns running. And I hear the same things, no matter what market it is. This is, if I had a penny for every time I heard this. Now, Bart, look, now, our market is a little bit different. Our market, they start selling me on all the reasons why people don't have the money. But I tell them, look, you're probably right 90% of the time. Let's say you get 100 leads and 90 of them can't afford any of it. You got 10 cases right there that are all $30,000 treatment plans. 10 of them that can't afford it. If you're using financing options, you know how to close. It doesn't matter what the majority does. That's a different way of thinking here, right? With big case advertising and selling any type of luxury product or service, what the majority does, we don't care. Because we don't need many, because the production level is so high for each. But at $25,000, if I come in, what do you charge me for the extractions? Do you add that on top? No. What do you charge me for sedation? What do you charge me for bone if I need bone grafting? What? Now, when you advertise, when you sell the case, do you show them, hey, you need 6 extractions. Here's how much it would normally cost. Line item it out. Almost nobody does, right? So my point is, with a $25,000 arch, what most people are going to have in there is they're going to have the 4 or the 6 implants. They're going to have the temporary. They're going to have the abutments. They're going to have the final. They're going to have the bar. They're going to have the same things, right? But there's a lot more work that you're actually doing. We just don't show them the value, and you can't tell them the value. You have to show it to them in dollars and cents, right? Absolutely. You show them.
The extractions, the bone, everything you talked about, temporary, and then say, here's what I'm going to do to help you out.
Yep.
I'm going to give you 6 instead of 4.
Right.
I'm not going to charge you for 2.
Mm-hmm.
So we get this down. We can try to get this down to 20,000 for you.
And why are we trying to do that? Why are we trying to do that? We're showing them they're getting a good deal. That's what it's about. That's how you sell big cases. They've got to look at it and feel good. If they don't feel good, they're going to shop you, right? They're going to shop you. They're going to run into somebody else that they're going to feel better with, okay? So what are some things that add value but they don't cost you guys anything? Anyone here doing a warranty or any type of clinical guarantee on the implant cases? Yeah? How much value does that add for your patients? Tremendous value, right? Tremendous, because you're going to spend $25,000, $30,000. What else are you going to buy for 30 grand with no warranty? What else are you going to buy? 30 grand with no recourse if it doesn't work like they say. You have none, 0. What are you going to buy? So a lot of times there's warranties, and that can add several $1,000s in value. So doing things like a 10-year warranty. I've got clients that do anywhere from a 5-year warranty all the way to a lifetime warranty. And when it comes to the warranties and the guarantees on implant cases, they just tie it to their maintenance. So basically, if you're coming back for every single maintenance visit, that warranty stands true. If you start missing maintenance visits, you come in, you have the implant surgery, you don't come back for 2, 3, 4 years, obviously the warranty is null and void. So you guys have some protection there too. You have to create values. You're going to charge $25,000. I want to show them $36,000 in work that they're getting. I want to show them that they're saving almost a third. This is how you sell anything big. Create urgency. We have to have the ability to create urgency in a sophisticated way without saying, now look, if you don't do anything, here's what's going to happen. You're going to wind up in da-na-na-na-na-na, right? And talking about all bad things that are going to happen to them. How do we create urgency in dentistry? It's the same way we do it in the advertising, the same way you guys do it in your treatment planning process. You use stories. My most successful clients have a suite of probably anywhere from 5 to 10 case studies that they share. And I say case studies because I'm talking to you. What it is just stories. You know, you remind me of a patient, so-and-so, that was dealing with a problem that was kind of similar. Let me show you this. Here's what they were dealing with, blah, blah, blah. And you're just helping them relate. If you tell them a story, they can draw all the conclusions and connect the dots themselves. Right? They can connect the dots themselves and go, oh, geez, I want to have what they had. Or, man, I don't want to wait and have the problem they had. I want to do this. So we have to be able to create urgency. If you guys don't have before and afters and you don't have some stories that are standardized, I would recommend getting that. Touch of pain points. We got to position you as the expert. We have to give you guys credibility. There's another percentage of the marketplace that doesn't care at all what the difference between $25,000 and $30,000 is. 25, 30, what's the difference? It's a lot, right? If I need a major procedure done, or I need something in medical, or I need something in dental, I'll pay more. I'm happy to pay more. I just want to make sure I'm going to the best. I want to go to someone that's not going to screw it up, someone's going to get me in and out, and someone where I don't have to worry about this being done right. Does that demographic exist in every single market? Yes, that demographic exists. How many of your competitors are talking to that market? None of them. When they look it up, when they look you up, do you look like an expert, or do you look like someone that's entry level? Do you look well put together and comprehensive, or do you look unorganized? Is your brand well thought out? Do you have a brand? The copy associated with your advertising, was it written by someone that knows what they're doing, or was it written by somebody that knows nothing about dentistry? Perception is reality when it comes to marketing. You're perceived to be unorganized, that's a reflection on your work, because they don't know any better right now. Any of you guys ever look something up, and just based on how they look with their advertising, you just clicked off and went somewhere else? Because you didn't think they were going to do the quality of work? Well, it's the same thing with you. Same exact thing. So the problem is, how do you say all of that? How do you say all of that quickly? How do you do it? How do we communicate in media? How do we communicate in advertising? Well, we communicate through content. What type of content is there? Well, we've got copy, right? We write copy, communicate through copy. Here's a landing page, write the landing page. This is going to educate you on A, B, and C. All right, that's one way. We also communicate through photography, right? What's the expression? Picture says 1,000 words. What's that mean? That means I can probably do a better job educating a patient with one really good before and after on all on four than I can a page of straight text explaining, articulating exactly what I'm going to do in the procedure and how I'm going to do it, right? And advertising is all about how do I communicate as quickly and as clear as I possibly can and create the emotion, using as little time as humanly possible. So photos, videos, audio. I know you guys have probably seen all the data, but no one works anymore. Everyone's on YouTube all day long, watching videos of God knows what. But we utilize a lot of videography because it's hard to create the emotion through copy alone, right? Because the emotion is what gets them saying, hey, it's time to do this. It's time to do this right now. I'll give you guys an idea here of how we do it using video with a client of ours. He's actually out here in California. He's one of the instructors for the Teeth Express course, prosthodontist, and he also worked at Clear Choice. He's done a lot of arches, Dr. Ferrier. And the problem that he was having is he brought in a new associate. There wasn't quite enough of these full arch cases to keep him busy just doing that. So he's still kind of doing some of the other small cases. So our job is basically to fill his schedule with reconstructions and with all on fours so that his associate was doing the bread and butter. And that's what we did. The first thing I had to do, I looked, the brand was terrible. I redid complete overhaul on the brand. Number one. Number two, he had no assets, zero. Nothing compelling. I said, if I take everything that you have, I wouldn't spend a penny advertising any of this. It's garbage. We have to create it. We have to start over. So we took almost 90 days with him before we ever advertised anything, just working on the videography, creating the assets so that when he did start spending money marketing, it would come back in spades and he would have a really low cost per lead and he would look different.
Hi, my name is Andrew Ferrier. I'm a prosthodontist and I've been in practice for over 10 years. I think what sets our dental practice apart from some of the others around us is that we really have a very comfortable, convenient office.
When I met him, the thing that came out that stuck out the most was that he really seemed to have a passion about how he did the teeth. They recommended the all-on-4 in order to get me the best results. I mean, people I didn't even realize tell me, wow, you're just so happy now. But the thing is, I can actually express it on my face. But yeah, now I can smile whenever I want.
We're going to be able to deliver treatment that's very predictable and give everybody a long-lasting result that they're very satisfied with.
The entire unit the tooth is recreated from a material that matches your own teeth. So there's no metal. I could not be more pleased with the appearance of my teeth after the procedure. Coming in here and realizing that all of the equipment, the technology, and expertise is right here in this room is amazing.
One of the big advantages of coming to our office is that we have an in-house laboratory with a laboratory technician on site. We have the ability to customize a crown or a tooth to make sure that it looks exactly like all the other teeth. This allows us also to deliver restorations that are of a very high quality all in the same visit. Having a laboratory technician there also allows us to provide some of the more complex implant treatments we have in one day.
It's changed my life, and in a way that I never expected it to. And I feel a comfort in life I've never had. I want to enjoy life, and I am now where I didn't before.
For any sort of complex crown and bridge treatment, maybe a full reconstruction of your teeth, and aesthetic treatments. Because I went to school for an extra 3 years and studied as a prosthodontist, we're very equipped to take care of those more complex cases that other offices might not feel as comfortable with.
He was able to inspire confidence in me to go ahead and take the next step. He just said he would always be there. He's a very compassionate as well as intelligent professional.
I think if you're really looking for a dental office where you're going to get a comfortable family type of environment, but with the same high level of care that you might expect from a specialist office. That's really what we're going to provide. And we're going to provide that to all of our patients and make sure everybody gets that same type of feel on an individualized basis, making sure that whatever you need, we can take care of that and deliver the best care possible for all the patients who come into our practice.
It's like from a communication, just from an influencing standpoint, how hard it is to say all that through copy, how hard it is to say that through graphics or an infographic. If we have assets, we have good, compelling assets that we can advertise, knowing what to do, that's our job, knowing how to allocate a budget to get the maximum amount of eyes for the lowest amount of money. That's what we do as professionals. But if we don't have any assets, then we have to create them, right? Through graphic designers, we have to create them through copywriters. And when it comes to big cases, it's not about the procedure, it's about the lifestyle change. It's about showing people a better version of themselves. And we're trying to sell them to get over their fears to get this done, because they're in the situation they're in because they've procrastinated for so long. And it's very difficult to do that if you don't have good images, if you don't have good videos, and if you don't have a strategy that's based on something other than $699 this or that or the other. Does that make sense, guys? So what we're going to do for you, and then I'll jump off here. I told Dr. Gordon I would do this, but we've got Jarrett Cora in the back, the small dude right here with the red tie. He's actually our VP, traveled all the way out here just for you guys. He'll set you guys up with a complimentary strategy session where you can just kind of fill us in on where the practice is, where you want it to be, and we're going to help create a strategy for you guys for no charge. There's a lot of people here that when it comes to building a strategy, there's things that you can do just internally to get off on the right foot, and things that some of my more senior doctors that are big clients of ours, if they would have known this 15 years ago or 10 years ago or 20 years ago, it would have been invaluable to them. So we're here to give you guys that type of information, extend that courtesy to you, and I'll be hanging around for a little bit longer for the day. But we've also got Jarrett and Jeff here in the back to answer any questions that you all have.
Another thing.
Yes, sir.
Do all of that. The front desk can tell you how they answer the phone.
Yep.
How they talk to the patient. If they're not prepared, they don't are knowledgeable about what you're doing, and they give the patient the wrong image, you're done.
Yep.
You can spend hundreds of thousands of dollars. Just that one quick story. Guy tried to copy my radio ad, and his last name is similar to mine.
Mm-hmm.
And so my treatment coordinator, who answers the phone, called and said, I heard your announcement on radio, and what is a dental implant? And she says, well, I'm not sure. It's these things they screw into your jaw. And then she says, well, does it hurt? She says, well, I don't know that either. She says, we had it recorded. And then she says, well, how many has he done? Has he done 100? She says, no, he ain't done 100. Like that, ain't done 100. He's done 59, he done 10? She says, yeah, I think maybe he's done 10. How many people, he spent all this money, how many people are going to
Mm-hmm.
That's marketing is the hardest thing we do.
Yep. In marketing and sales, there's no different, and he's right. And that's why a big part of our business now is our continuing education courses that we do. I think out of the next 10 weeks, I'm on the road speaking for 9 of them. It's not on marketing, it's how to close the cases internally, how to answer the phone, how to treatment plan, how to triage through a lot of unqualified leads quickly so they don't bog your schedule down, how to spend 10 minutes of doctor time and utilize your treatment coordinator correctly. So all those things are just as important as the advertising. But again, that's kind of where we start off with, where are you, where do you want to be, and how do we start to create a strategy that you can begin to implement over the next several months so that you guys have a really good chance of growing your implant practice and doing it in a really profitable and effective way. Okay, thanks guys, appreciate it.